Hi, welcome to Low-sal-life. I'm Sarah, and it's been a while since I've been online. And there's some good reasons for that, and we're just going to talk about one of the issues today. As you know, I have done a low-salicylate diet for a very long time. It is my major trigger and my major allergen. I started in 2019, and for about 3 or 4 years, maybe even earlier, 3 to 4 years, it was honeymoon, results, bliss. Every problem I had was resolved, which is why I started the site, and I started the channel. It was about education around salicylates, and it was so helpful for me to wrap my head around it and really dive in and get control over my symptoms and my body. But it turns out that honeymoon bliss was short-lived, and sure enough, as time went on, I developed more sensitivities, and it's not just what I eat or breathe in, like fragrances or chemicals, fragrances and chemicals, or medicines, but it's a little bit more than that. So the last 2 years, I've been really struggling with a lot of symptoms, even though I continue to stay on a low salicylate diet, and it's just been widespread and uncomfortable. So today we're going to talk about what were the new symptoms I had or that I could not control with a low salicylate diet, a very short synopsis of what I did to get a diagnosis, and then what I'm taking currently. And I want to share this with the low salicylate community because there's things that I think that are over the counter that I think would help manage some of those severe salicylate reactions, even if you haven't gotten a mast cell activation syndrome diagnosis. So I just want to take this little snippet in time and talk about the medicines I'm on that have stabilized me. But I have tried a lot, and if you haven't started a diagnosis for mast cell activation syndrome, you may find that it's a lot of trial with medicines, including the same medicine but different vendors, because of the added ingredients, the excipients. You might react to one and not a different brand. So it's been a journey. So let's get started. And the first thing I'll talk about are some of my newer symptoms that I've had, probably starting about 2.5 years ago, late 2023. Mid 23, I had a great year. I flipped a house for my dad and sold his house, got him moved into senior housing. And then I broke my toe in September. I did an antibiotic. I was out for about 2 months while my foot healed. And then I went back at it, sold the house, and after that I went through a really dark, yucky period where I just had horrible symptoms trying to recover from my broken foot, and probably recovering from an added stress. Who knows what chemicals or mold spores I was exposed to. And so 2024 was really a dark period for me. And then in 2023, I had a whole root canal issue, which we'll get into in upcoming videos because I'm going to go have it treated again. So there might be an underlying infection as well. So that's another thing for us to deal with on another day. So anyway, as you can see, there's a lot of different things that could have triggered more severe reactions. And some of the top ones are low activity from a broken foot, high stress from selling a house that was in the family for 40 years, exposure to mold or chemicals, the emotional stress, dealing with family during that period, and their reactions to what was going on. And what was the last one? Oh, and infection, underlying infection. So there's a lot going on there. So these all could be like components to triggering or making mast cell activation syndrome worse. There's like a whole grid of 4 things to look into if you're trying to fix your MCAS. So anyway, so that was 23. 24, I came out of the gate with extreme joint pain, extreme fatigue. I was just a lot of headaches and just really not feeling good. And that's when I started going and seeing doctors. I think April 24 was my first immunologist appointment. I've seen a lot of different specialists trying to get to the bottom of this. Other symptoms were digestive problems again, having diarrhea, like kind of rashy, itchy feeling down there, like as if I ate a whole bunch of jalapenos and felt like really rashy on the way out. I thought that they were related to diarrhea, but they're actually 2 separate issues. My diarrhea resolved last year, but I still had that rashy, itchy feeling on my skin. So, but that has also resolved and stabilized. I was not having nausea, but I am having nausea now. So that's new and different. I was having migraines. My migraines spiked to about 4. I was probably having about 8 migraines a month. And if you're a migraineur, you know that is in the severe level. So I was evaluated for that. Let's see. I'm sure a few other things will come up, but hives and joint pain and digestive issues were the biggest problems for me, and just overall itchy. So for a mast cell diagnosis, mast cell activation syndrome diagnosis, there was a new checklist that came out. I couldn't find it super easily, and it depends on which immunologist you go to. They might code or kind of treat you differently. But the setup that I found was if you have reactions that affect 2 or more bodily systems, so like skin and digestion, or lungs and muscles, or like your skeletal muscle joint pain, and neurological symptoms like migraines, or blood pressure drops, cardiological issues with digestive issues. So if you have a combination of 2 systems, I can't say systems, can't spell it either, 2 or more systems, then that's the first check mark for mast cell activation syndrome. And then the second one is that you respond to treatment that specifically affects mast cells. Or the release of whatever chemicals that they can put into your body. So if you respond to antihistamines, or there's leukotriene receptor agonists, I wrote that down, yeah. So that's an option if you respond to mast cell stabilizers. So any of those treatments. And then there's like a third box or category, which is actually hitting some of the lab markers that indicate that you have a mast cell problem. So some of those things are not necessary for diagnosis, but that includes things like a high tryptase level, or a change in a stable and a reactive level of tryptase. So if there's like a percentage increase in that blood test, if you have the genetic markers for mast cell problems, if you had like a colonoscopy or some kind of tissue culture that they stained for mast cells, and if you have like a higher level of mast cells for that area, then that could be helpful for a diagnosis. That could potentially be a different diagnosis, like MCAD. So those are some of the markers. I had a tryptase level, it came back normal. I had the DNA testing, that came back normal. I have not had any tissue samples yet. I also haven't had a tryptase level taken during a flare. So I can't look at the before and after tryptase levels right now. Okay, so we've talked about my symptoms. We've talked about how to get diagnosed with it, more or less. So let's talk about how I got my diagnosis. I went hard. I was a little desperate. I went hard at it. I discovered that I am also hypermobile. I looked at the POTS definition and realized I would say it's a mild case of POTS, but I still hit the markers, the clinical markers for POTS diagnosis. So with the EDS, hypermobile combo with the POTS and the MCAS, I decided to sign up for the EDS clinic. It was a phenomenal experience. I felt really discouraged when I went through and filled out the paperwork. It took a long time to fill out the form, like an hour or two. And it sounded like it was going to be forever, months and months and months to get a diagnosis, to get seen by them. It went faster than I expected. I did have to pay out of pocket. It was not covered by my insurance. It was about $300 to $350, but probably one of the best doctor's appointments I've ever had in my life. So grateful to them. So when I got on, I was seen by a doctor from that region, somewhere in the Midwest, Michigan, Chicago, Iowa, I don't know, somewhere in the middle of the US, a doctor. And then there was a doctor from Seattle, which is in the state that I'm in. And then there was a scribe or like a physician's assistant or a nurse assistant who was taking notes. The appointment lasted about an hour and a half. And the thing that we talked most about was getting a diagnosis and managing the severe symptoms. Because I was having like nausea and acid reflux in some nights, and then I wouldn't sleep very well, and then I'd be really tired, and then I'd be more reactive during the day, and I was just in a really bad loop. So with the combination of that appointment, I ended up with a whole bunch of really helpful medicines that helped me become more stabilized, that just took care of the emergency type reactions. So I already have an EpiPen. I already use Benadryl for histamine reactions, like when I'm having an allergic reaction. They gave me hydroxyzine. It was 10 milligrams. I could take 2 at night, and that would help keep me and my symptoms. It lasts longer than Benadryl, and it would help me keep asleep during the night and also manage some of those reactions. They also gave me an anti-nausea that I could take so that those nights when I'm like, do I need to go to the walk-in clinic or emergency room, I could just take one of those. They gave me some cortisone to just help manage reactions during those extreme flare-ups. And then I think that those were the majority of the emergency type response medicines. The hydroxyzine I took for almost a full year. I really liked it. I only took it at bedtime, and the only reason why I stopped was because I'd been having fatigue issues during the day, and with some of the other medicines, I didn't want it piling up. So the hydroxyzine worked really well for me for a long time, and I would maybe consider doing that in the future again. Anyway, the majority of those, I'm not using the steroids anymore or the hydroxyzine, and I very rarely use the anti-nausea. They also diagnosed me on the hypermobile spectrum disorder. They had me do the Baton thing online with my webcam, and it was pretty easy to pass the hypermobility. It's 9 check marks, and so I passed that. So they diagnosed me with the hypermobile spectrum disorder, and then with instructions on how to continue to see where I land on that HEDS or genetic EDS types. And I'm still waiting to get in with the geneticist. I've been waiting a year and 3 months for the clinic referral that I've been waiting for. So that's a problem for another day. They said I probably do have POTS. I let them know what like my heart rates were like sitting versus standing and some of my symptoms. But like I said, that's a low priority for me. I usually only notice it at very specific times, and so it's not super debilitating for me. But they did diagnose me with MCAS at the end of that appointment. So totally worth my $300 to have that wrapped up so nicely. Now, I did continue. I was on a wait to see a local immunologist, and she also confirmed the diagnosis of mast cell activation syndrome. So I have it from 2 doctors over like 6 months. They went with that. Moving to my immunologist, we're looking at, first of all, what's the diagnosis? How do I get treatments? And what medicines am I going to respond to stabilize me? So the EDS clinic worked on extreme reactions, making sure that I'm safe and I'm not like all over the place, and my immunologists were working with stability. So the first thing we started with at my immunologist was antihistamines. And I don't know if you guys have watched, I'm pretty sure I've talked about it in the past, but I don't do very well with antihistamines. Benadryl's been fine. The hydroxyzine's been fine. Claritin was not fine, and the other happy one, Allegra, was not okay. Both of those made me super anxious, and I am not an anxious person. I do not have anxiety. I'm so grateful, but those medicines make me so anxious, and they also give me a sense of dread, like something bad's gonna happen. It is the weirdest brain trip when you don't have it and then all of a sudden you do, just because of an antihistamine. So I have not used those. I was really hesitant to start a daytime daily antihistamine, but I found one. I tried cetirizine, and I don't know why I didn't start with that one. I did test it. I think maybe I got Allegra and the cetirizine mixed up, and I couldn't remember which one. So I tried this one. Let's see. This is an Amazon one, and it's pretty cheap. I don't know if it's Amazon brand, but I get it on Amazon. So this is levocetirizine. It is pretty much, if cetirizine is like this for handedness, levocetirizine is like this. And this one is 5 milligrams. I started off with 1 a day, and then I got moved up to 2 a day, and now I'm at 3 a day. And I've played around dropping back down to 2, but 3 is a good spot for me. I don't seem to have any symptoms. There is the option that it might make you drowsy. I do not experience any drowsiness with this, although I am chronically tired, but that's a whole nother thing. I don't think it's related to this medicine. So the things that I noticed right away starting a daily antihistamine is that my joint pain went away. Like within a month, like I could barely walk up and down the stairs, and like now I mostly don't have any joint pain. So that is the main reason why I am on this. Because if I'm not, then the joint pain starts. I don't know if it really affected my hives. I was having hives like 4 or 5 times a day, or a week, usually at least 2 to 5 hives like on my chest and back, and itchy scalp. So with that, I don't know if it reduced that or reduced stomach problems, but the joint pain was enough of a reason to take it. So let's see, what else? So that was the first thing we tried. We started off again with 1. I will say the instructions on this, I'm on it over the counter. I tried getting a prescription for it so to like reduce cost, but they were like, you can buy it over the counter. So I did not get a discount doing prescription with that. The second thing we tried was histamine 2. So this is a histamine 1. Histamine 1 is the non-drowsies are Claritin, Allegra, cetirizine, levocetirizine. Those are your 4 non-drowsy antihistamine 1. Antihistamines work, 1, mostly for skin, your nasal cavities, for me, joints, that kind of thing. So the second thing is I started an histamine 2, antihistamine 2 blocker, and this is the one I'm on right now. If you are getting started and you want to play around yourself, I'm not a doctor. This is just my experience. This is just for education. The one that I tried before, which I think is better tolerated by a lot of people, is Pepcid. And H2 blockers work mostly for your digestive system, and I can feel this and tell night and day, feeling so much better with it. Pepcid is longer acting. It lasts for about 12 hours, and I cannot take it at all. I can take like 1 to 3 tablets over like 2 to 3 days, but as you guys know, I have dystonia and I have muscle spasms that I take medicine for. I take levodopa, carbidopa for it. It turns out Pepcid triggers my dystonia, so I cannot take Pepcid. But there are other options for over-the-counter. I ended up on Tagamet. These are short-acting. They only last a few hours. I would say like 2 to 3 hours max. This is a 200 milligram dose, and my doctor said that I can take up to 5 of those a day. On average, I just take 3. I take one at 6 a.m., at lunchtime at around noon, and then one at 6. And then that gives me 2 spares that I can go up to in a day, where I can have up to 5. So sometimes, like if I have a snack, or my symptoms are worse between like 2 and 10, that's when I feel the worst. So I can take one at nighttime, and that helps a lot. These help with, they help a little bit with diarrhea. They're probably helping more than I know with that, but they help with that rashy feeling, as if you just had diarrhea. Like you had too many jalapenos. I don't eat jalapenos, but if you had like really spicy food and you get that rashy burning feeling, this helps. So once I start getting that itchy, burny, gross feeling, I will take one of these and it goes away right away. It also helps with nausea. So when I start feeling like I'm gonna throw up, I usually feel like my blood pressure drops, or feel like a little bit dizzy, and then I get nauseous. I'll take one of these and it takes care of that. So if you can tolerate Pepcid just fine, that's a first choice because it's long lasting. This is second choice. There are some liver concerns with this. Before I started, I got my liver checked, like just blood tests, and I am doing that every 6 months just to make sure that there aren't any changes. And I've been on it for about 1.5 years, and I have not had any issues with liver changes. I will say this is my favorite brand. There's an Amazon one and an Equate. They are inexpensive. I'm not going to show you the bottle because they are inexpensive. They're good. They're effective. But this bottle I have here on my desk because it smells funky. It's disgusting. And in the comments of like the reviews, like this lot is bad. I reported it to FDA as like a potential like bad batch, and when I was taking it, like I got sick or it did not manage my symptoms. So I have a whole bottle of unused stuff here. I'm gonna let it blow over for about 6 months, and then I'll give it a try and see if they fixed whatever issue it is. But this brand, Amazon, is made by the same exact company as the Equate Walmart brand. I know because I bought them and I compared the manufacturers and the lot codes, and the Equate one for the same spring 2027 lot batch also smells disgusting and also did not work. So I'm on a hiatus for these guys. I did get a prescription for it, which was less expensive, but they come in disgusting little green vanillin scented tablets, and they are disgusting. And I also think that the vanillin has like a salicylate, or I haven't really verified that, but it's potentially has salicylates in it. Anyway, I react to vanillin, so taking a medicine with something that triggers a reaction is kind of counterintuitive. So right now I'm using Tagamet. That's the only one that I've found that I can take currently, and they make them in Spain, and that's what I'm on. Not the cheapest, but it's better than nothing. And like I said, it's really one of my most useful drugs. I was really hoping this wasn't going to be a 30-minute video, but we all know that I can't make it quick. This is complex stuff. It's taken me 1.5 years to figure this out. Okay, the next thing that I tried and failed were leukotriene receptor antagonists. I think they're agonists. The first one I tried was montelukast, and I think that one's singular. And then the second one I tried was zaferlukast, also known as accolate. I tried both of those. I was really helpful. Basically what happens is when you have a reaction, your mast cells send out histamine, but they also can send out leukotrienes, and trying to manage leukotrienes in your body is helpful for managing symptoms. Both of these I failed terribly, and the reason why, so this will probably not work, be your case, but because of my dystonia, it triggers dystonia. So basically after taking it for 3 or 4 days, I couldn't even walk. My muscle spasms were so severe. So it is a no for leukotriene receptor agonists for me. I tried both of them. I was so hopeful. I tried both of them at least 3 or 4 times with like a month in between, and tried lots of different ways to try them, and it was a no-go. Okay, so I have my H1 blocker, my H2 blocker. I failed leukotriene receptor agonists. And so the next thing to do is to try and find something to block your mast cells from firing and to calm them down. So I got on a mast cell stabilizer. Oh, actually, the next thing that, I didn't bring them up. So the next thing that I got on in September 2024 was cromolyn. I was still having diarrhea and brain fog as my 2 main symptoms at that time. And I started, they give you like 2 vials per meal per day, and then a set before bed. So I got 8 vials of cromolyn to have every single day, and I dilute them in water, and I take them a half hour before I eat, and then before bed. And that was really helpful. I could feel like my brain turned on by like another 10 or 15% almost overnight. Like within a few days, my brain was feeling much better. I was so grateful for that. Not the long-term solution for tiredness and brain fog, but it did make a little bit of a difference. It was helpful. It did help with digestion. I got up to 12 a day. So I'd start the morning with some. I'd take 1 vial at 9, take it 2 at noon, 1 vial at 3, 2 at 6, 1 or 2 vials at 1 vial at 8, and then 2 at bedtime. So it totaled up to 12. And I did that for about 6 months. And so that's been really helpful. Cromolyn is only digested through your digestion system. So most of it is excreted through digestive. So it's nice because it doesn't like affect your liver like the cimetidine. And I've been really trying to make sure that the load of all of my medicines combined aren't all like putting all the effort on my liver. So that was one nice thing about the cromolyn, is that it's not really absorbed into your body. Probably also not that great because it only affects your digestive system. But remember, we have a gut microbiome, and serotonin and dopamine and all that type of stuff is made in your gut. So a lot of people, even if they don't have digestive symptoms, may benefit from cromolyn for other systems. There's a lot of videos that talk about that. Besides cromolyn digestively, I do the nasal crom. This is just cromolyn and nose spray. I'll do this mostly when before I go to a smelly place, like if I want to go to Goodwill, I'll spray some of this so my system's not as sensitive to perfumes, or if I have to go to the office or carpool with somebody that might have an air freshener. That's the main time I use these. We did experiment to see if controlling nasal, the nose with cromolyn, nasal cromolyn, if that would affect brain fog or hives or digestive problems, and I did not see a difference with that. Some people, according to my immunologist, report that adding nasal crom to the setup can affect more than just nasal type reactions. Okay, so that's cromolyn. Next is the mast cell stabilizer. I don't know when I got on this, probably early 2025. This is not over the counter. You definitely need to work with your doctor to get on this. This is ketotifen 1 milligram capsules. I'm getting it compounded from a pharmacy. It is not cheap. It is out of pocket. This bottle has enough for 3 months times 3 doses a day. It cost me about $150. I don't live near a compounding pharmacy. It's over an hour away. And when I need it, I'm not necessarily in town. So they do deliver for an extra $6. So that's the setup I have with them. These make you drowsy. And that's the main reason why people don't do well on them. In the US, they are not FDA approved for mast cell treatment or for hives. And so that's why I have to pay out of pocket for it. I do appreciate the compounding pharmacy because it doesn't have a bunch of crap in it. Unlike the cimetidine, it has SLS in it, you guys, like just whatever. So anyway, I do appreciate that it is compounded. There's no dyes or weird things added to it. This here makes me so tired, but I was willing to manage symptoms to see if maybe being tired was a symptom of mast cell issues, and I felt more tired, but I feel like I kind of got used to it. So I basically ended up testing 1 and then 2 and 3. These have really helped with the diarrhea, a little tiny bit with the hives, but I was up to 1 in the morning, 1 in the afternoon, 1 at bedtime. I have since, because I need to work for a living and pay bills, I have since looked around and see how other people are taking it. I've moved this to a 6 p.m. and 8 p.m. so that the tiredness kind of wears off by the time I have to wake up the next morning. I also am chronically a night person, so I figured if I start it earlier, like at 6 or 8, then I'll be tired by the time bedtime comes around. I think that's kind of helping, and then if I sleep well, then I wake up feeling good. I have some hacks that I'll talk about later, but this affects your cholinergic system, and I did find something to help offset the tiredness, and it is not super talked about, so I'll do like a smaller video about that on a different day. But mast cell stabilizer, there are other things I've heard for mast cell stabilization that's like over the counter, and I'm still on the fence if vitamin C is one or not. I've heard antihistamine or mast cell stabilizer. Vitamin C, I have issues with. Sometimes it does cause nausea for me, so I try and avoid it. I've tried a lot of different kinds, but unreliable vitamin C. Quercetin, I would get muscle spasms for that or digestive upset from that. And I haven't really found anything else. I heard a little rumor that maybe amylase might be an mast cell stabilizer. I don't think it necessarily is, but I've also tried that and didn't see anything significant. Ketotifen. Good if you can stay awake for it. Is that everything? Those are all my main medicines besides levodopa that I take for muscle stuff. This is just for stabilizing me and getting me upright and thinking. There is one more I will talk about. So of course, gut microbiome stuff, and oh yeah, there's actually one more really important medicine. I'll talk about that. I think I've got to test it. I have to stop it and test it again. I've done it once. This one, I've tried all the probiotics, you guys, but this one I think actually does help, and it is the Akkermansia. One of you guys mentioned it in an email, and I couldn't tell if it was an ad or if it was a genuine message, but it linked to a probiotic that was $150 for a bottle, and I was like, yeah, let's look and see what the active ingredient is. So I got this. I think this one's much less. It should be in like the $20 to $40 range for 60 capsules, I think. So I've been taking one of these at 6 p.m. every day with my meal, and I think it really is probably one of the most significant contributors to managing my diarrhea. I have to try it off and try it off and on again and see if that's the case. And I've been taking it for about 6 months to a year, which is about when that symptom went away. But I started both this and this at the same time, so it's kind of hard to tell. But I did stop this once and my symptoms did come back. So that's why I think that it might be that. Okay, so the last thing that still remains is hives, which has been chronic. So I was really disheartened when I worked with my immunologist about getting a mast cell activation syndrome diagnosis. And for the longest time, when I looked at the clinic notes, it basically just said what my symptoms were, and rather than giving me a diagnosis, it just said like chronic hives, I can't even think the clinical term for it. I did have angioedema. Let's see. Urticaria. Gosh, I'm such a dork. Okay, so anyway, it just said chronic urticaria without any known cause. And so that is true. Sometimes I have a known cause, sometimes I don't have a known cause. And up until about 7 months ago, I was having them several times a week and just really itchy all over. So I did get on Xolair, and that is it's a biologic injection that you get about once a month. I'm on the 300 milliliter dose, 300 of the Xolair once monthly, and it has been the main thing that's taken care of my hives. I still have them probably once or twice a week. It's reduced it. It's possible I might need a more frequent dose or maybe a like a higher dose. I've been on it for about 7 months. So the first 3 months I had to go in and have it done in person. Once I passed the 3 months without a severe reaction, I was able to do it at home. Those are expensive. It's crazy. So apparently they're like $6,000 a shot. And fortunately I have private insurance through my employment. I I work for the state, technically. So I have good insurance. I go through a specialty pharmacy, and even at that, it would have been $175 a month for the injection after my insurance paid for the remaining amount. That $175 is covered. I had to apply for a Xolair coupon, which gives you $12,000 a year if you're covered by a private insurance. It took me about 2-3 hours to make all the phone calls and do the paperwork and everything, but they were really quick and responsive. So I have a $12,000 credit to cover my copay each month. So $175, which is what my insurance doesn't cover, that's my copay. And that comes out to $2,100, and Xolair would cover up to $12,000. So obviously I'm nowhere near that. So right now the Xolair injections are free for me, free, you know, you pay somewhere, but there is no monthly out-of-pocket expense for me, and they get FedEx to my house, and I really haven't had any issues with them. There is an extra phone call or two each month to make sure that it gets sent out, and I think it depends on who your specialty pharmacy is. So I've learned a lot about insurance this year and about pharmacies. There's over-the-counter over-the-counter drugs, there's pharmacies, there's compounding pharmacies, and now I'm at a specialty pharmacy to manage Xolair. So that is helping a lot. I do have a naturopath that manages complex situations like EDS, POTS, MCAS, and I've been seeing him for about 1.5 years. I think he was really hopeful that if I got on Xolair, that some of my food allergies would decrease or some of my other symptoms would improve. I haven't noticed a difference with it. The only thing I notice is that it affects my skin better, which is what it's designed for. So that immunologist that I was kind of upset for not diagnosing me with MCAS for 9 months, the reason she did that and put that I just had chronic urticaria is because you can't get Xolair for MCAS. You can get Xolair for chronic urticaria. There's 2 other situations like food, protein allergies, and asthma. It can help with those situations, and then chronic urticaria. So she mostly tracked in my chart for months and months and months and months that I was basically just seeing her for chronic hives, even though I had all these other things, and even though she was treating me as a patient for MCAS, in her notes, it just said chronic urticaria. So don't get discouraged if it takes a long time to get an MCAS diagnosis. There might be other reasons why, and going through the whole Xolair situation was really eye-opening to figure out what that system looks like. In order to get on Xolair, I had to fill out a thing that said we've tried everything else. So we had to say that we are stabilized with H1 blockers. We are stabilized with H2 blockers. I've failed the leukotriene agonist. I am not responding well to other treatments. And after that, with the chart notes of chronic urticaria, I was able to get on Xolair. And as far as symptoms go, I have been very tired or even moody after a Xolair injection for like a day or two. It might have corresponded with PMS because it was on a monthly cycle for me every 4 weeks. I am past that, and now I'm not noticing any symptoms. I started in September, so I think I've had about 8 injections. So things are getting pretty stable with the Xolair. Okay, I think that's it. We talked about new symptoms, how to get diagnosed, what my diagnosis process looked like, all the medicines that I'm taking to be stabilized and sitting here without any major issues. And I am sorry that I cannot do these in a more streamlined shortened version. I do hope that maybe this year I can do some shorts, just some little tidbits of things that I learn along the way. I'm hoping to start doing those. So with all of that and a scratchy throat, I will see you guys later. Good luck. I am uploading and updating the Low-sal-life site a little bit more frequently. I've added a few things to the directory, and I added a note about olive oil to the low-sal values, and I am checking email a little bit more. And I think I'm looking forward to a better year. So yeah, wishing you the very best, and I'll talk to you guys later. Bye.